Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about the difference between an evolutionary change and a revolutionary change, and which one would we consider knee replacement surgery. Everyone, so we're talking about revolutionary change and evolutionary change, and we're going to consider this in relation to a knee replacement surgery. So let's quickly define those two. So a revolutionary change, so you think about a revolution, so a revolutionary war or a country that undergoes a revolution. This is something that is quick, rapid, a quick change, a quick turnaround. So it was something A, and now all of a sudden it's something B. Something has changed quickly. It's a revolution, quick, rapid change. Now, an evolutionary change, we're thinking about something that is a subtle, slower process that occurs slowly over time. So something that is one thing, and then slowly over time, subtle changes, subtle differences, subtle things happen, and eventually it changes to something B. So really the main difference is revolutionary change, something rapid, something quick. Evolutionary change, something slowly occurs, slowly changes over time. So what exactly is a knee replacement surgery? What would we categorize that as? Well, for myself, when I think about this, I think about, the surgery itself. You go into surgery, and your surgery is maybe 45 minutes, an hour long. You go in with a knee that has arthritis, pain, discomfort. Your normal, your regular, yourself, your own bones and anatomy. And then after that procedure, you come out of surgery and you have a new knee, new metal components, new polyethylene plastic spacer. You have new prosthetic knee in your joint. So that, I would consider that's a revolutionary change. That's something really quick, something happens immediately. But now, let's talk about your rehab and your recovery. This I'm going to consider, and I think we all should consider, and this helps us kind of process and know what to expect, is your rehab and your recovery after surgery is an evolutionary change. That day of surgery, those first few days after surgery, you have significant pain, you have swelling, you have stiffness, you have achiness, you have all sorts of symptoms and things going on. You have decreased mobility, you have difficulty walking and tolerating activities, you have muscle weakness. You have all these things going on, and they are significant, and they are impacting you significantly. And you don't necessarily go through 1 week of rehab and then all of a sudden you're healed and you feel better. You don't all of a sudden go through 8 weeks or 12 weeks of rehab and all of a sudden you feel better and now you're back to normal. It is an evolutionary change. It is slow changes, slow improvements over time. You slowly, your pain levels decrease a little bit, decrease a little bit, decrease a little bit. Some days it might actually, you have an issue, you have a plateau for a little bit. Or some days you may have a decline and you may have increased pain for a day or a few days for whatever reason. And the same thing with all your other symptoms, with your swelling, with your stiffness, with your strength and mobility. You may have days where it's positive and you're increasing and you're improving and you're evolving. You may have days where it flatlines and you're just kind of feel like you're plateauing. You may have days where you're decreasing or you're getting worse and your symptoms are getting worse. This is perfectly normal. That overall trajectory, we want it to be positive, but within there's going to be ups, there's going to be downs, there's going to be plateaus, and that's perfectly normal. And the thing is, with this evolutionary change, so it's not like you're going to wake up at 3 months out from surgery one day and you're going to feel 100% better and back to normal. You're not going to wake up someday 6 months out from surgery and feel 100% better and back to normal. It's slowly going to get better day after day after day. You're going to have decreased frequency, decreased intensity in symptoms, in pain, in stiffness, in everything. Slowly, it's going to decrease in frequency, it's going to decrease in intensity, where it's going to be hopefully to a point where it's very minimal and you can manage your symptoms and you're able to function, you're able to do the things you want, do the activities you want, you're able to live your day-to-day life with relatively little discomfort and pain. That is the goal. So is knee replacement a revolutionary change or an evolutionary change? I think it's both. It's initially a revolutionary change, something rapid, quick, you have surgery, but the rehab and the recovery is going to be an evolutionary change. Slow, subtle, over time. Takes patience and consistency above all else. So that's something that I think is a good mindset to have with your rehab and recovery, something to keep in mind to help focus you and to help keep you consistent and help keep you not to have unrealistic expectations about your rehab and your recovery. So thank you very much for watching, everyone. Be sure to subscribe and hit that button so you get notifications whenever we post a new video. Be sure to leave a comment below if you have questions or you have comments or concerns. I'll be sure to get back to you. Be sure to leave a like as well to help spread this video and get it out to all the folks who can benefit and need it most. Thank you again for watching.